Good evening. Can everyone hear okay? Good. Welcome, welcome. This is our virtual town hall, and my name is Cynthia Dampier, and I'll be somewhat of your host, although I'm co-hosted by for three other people on the line, thank goodness. Um, and what I do for Integrated Family Services, I do program services and business management. So basically, I run the office and then I help smooth out the programs to make them run efficiently. In Integration Family, we're located in Tukwila. We serve the Somali and BIPOC community. We serve Tukwila in South King County. I hope I'm talking slow enough. I apologize. Start running away there. Um, and so this event is co-sponsored by Public Health of Seattle and King County, and we'll just jump right in. Um, Thank you, Dr. Ibrahim, for joining us um, this evening. We are honored to have you, and I've heard so much about you before I even got to see you, so that's great. Dr. Ibrahim is an esteemed leader in the medical and public health community, and she wears many hats, as I'm told. Um, she is a clinic associate professor of pediatrics at the University of Washington and medical director at Harborview Pediatrics. That's the clinic there at Harborview, and president of the Somali Health Board. Dr. Ibrahim's clinic interests include caring for outreach to immigrants and refugee populations, specifically those who have medical and social complexities. Um, thank goodness. Dr. Ibrahim is a strong advocate for community-focused work partnerships. Thank you for being here. So this is a part of a partnership. Thank you. And we appreciate your input. Again, we want to remind you that you are welcome to put your questions in the chat. And at this time, I'll turn it over to Dr. Ibrahim.
Great. Thank you so much, Cynthia. Cynthia, I see that you have the PowerPoint up there. Should I share my screen or are you okay advancing?
It's certainly up to you, whatever you feel more comfortable with. I can stop sharing now and you can certainly.
Let me. Okay, I will start to share my screen now. Let's do it that way. Okay, are you guys able to see my screen?
Yes, we can.
Okay.
Thank you.
Wonderful. Hello and good evening. Assalamu alaikum, everyone. I'm Dr. Anisa Ibrahim, and I'm so honored to be here with you guys tonight. Today, I hope to talk a little bit about vaccines, as routine childhood immunizations, and a little bit about the COVID-19 vaccine as well. I hope to talk only for a short amount of time and then have some room for discussion and question and answer, because I do think that that back and forth and that engagement is what really helps get people's questions answered, and we learn a lot from each other during that time as well. Here's a look at tonight's agenda. Cynthia, thank you so much for introducing me. So we hope to, I think we discussed about how to access Somali interpretation. I will talk about routine childhood immunizations and why they're still important, especially during the last 2 years. We've lost a little bit of ground with ensuring that all kids are getting the routine childhood vaccines. And that's with reason, right? With the COVID-19 pandemic, there were stay-at-home orders, kids were not in school, a lot of parents were out of work, but now is really a time to focus on the importance of routine childhood immunizations, and also making sure that your kids get caught up. Next, we're going to talk a little bit about the flu vaccine and why it's very, very important, especially this season. And then I'll talk a little bit about the COVID-19 vaccine. Oh, yes, absolutely. Sorry. Next, we'll talk a little bit about the influenza vaccine and why it is very important, especially this season. And then I will move on to discuss the COVID-19 vaccine for children specifically, why it's very important, and then as well as talking about the COVID-19 booster. So these are a few questions that come up routinely when people discuss and talk about routine childhood immunizations. When I say routine childhood immunizations, these are the vaccine preventable illnesses that we give vaccines to children against. These include things like hepatitis B, tetanus, whooping cough, and measles, mumps, and rubella. Questions that I get asked the most, especially as a pediatrician, are questions like, are the vaccines safe? Are the vaccines effective? Why are the vaccines important? And then hoping to discuss a little bit about concerns and myths. By myths, I mean misinformation or things that people believe in the community, which have been researched and found out to not be true. So first and foremost, I want to discuss the question about whether or not vaccines are safe. Being a doctor myself and also a mother, I think about this question often. And I can wholeheartedly say that vaccines have been proven to be both safe and effective. There are many safety regulations that all vaccines have to go through in order to be approved and get to the general public. These vaccines are tested even before they do what is called human or clinical trials. And then even after they're released to the general public, the vaccines continue to get monitored. Prior to vaccines being administered to the general public, clinical trials are where vaccines are administered or given to thousands of people. And what scientists are looking for during that time is the vaccine safe? Are there side effects? And is it effective? And only after going through all of those steps and the regulatory bodies that we've been hearing about, such as the FDA, only after all of those steps have been met can a vaccine be approved to be given to the general public. Now, because of that, and because of the evidence that I have seen and reviewed, and like many other doctors, I'm comfortable saying that we know routine childhood immunizations and the COVID-19 vaccine and the influenza vaccine are safe, and that we have not seen any.
Excuse me, Doc. I just wanted to acknowledge Ishmael has his hand raised for a minute.
Oh, sorry.
And
sorry, I'm not able to see that. Maybe I'm going too fast still.
Yeah. Ishmael, can you hear us? Okay, so his hand is down now. I apologize. We're good.
No worries. Am I doing better? I tend to speak fast. Okay.
Yeah, you might want to go a little
Absolutely.
slower, just a little. Yeah, thank you.
Yeah. Where was I? So after vaccines are approved for the general public, meaning that we are giving vaccines to people, the evaluation of whether the vaccine continues to be safe does not stop. So even the vaccines that we are giving routinely now to infants, to children, including the flu vaccine and the COVID vaccine, all of these vaccines are continuing to be monitored, meaning that if there is an adverse reaction or an adverse event, these things are reported, and those reports are evaluated to see if there's anything that is concerning with regards to the vaccine safety. One thing that I have been discussing a lot with a lot of my patients, but also the community, is how long we expect to see side effects from vaccines. Now, I know that side effects are something that many people have questions about. One of the things that our body does after being given a vaccine is the vaccine essentially trains our body's immune system of that protection. It can remember what that disease looks like. And if we were to ever encounter it, the body can attack and then help us make sure that we are not getting sick or dying from this illness. After the body gets trained or receives the instructions, the components of the vaccine are actually destroyed, meaning that they don't stay within our body. The only thing that's left is our immune system's memory and ability to remember what a certain infection looks like. Because of that, we are able to say that most side effects that come from vaccines, we will see within 6 to 8 weeks. Now, all of the routine childhood immunizations, including the COVID-19 vaccine, we've been vaccinating people for many years. With regards to the COVID-19 vaccine, we've been vaccinating for people for over a year, almost 2 years for people in the clinical trial. So because of this, we're able to say that we have seen almost all of the side effects that are going to be coming from a vaccine, including the COVID-19 vaccine. Those side effects overall have been minimal. And when you look at risk versus benefit, we know that the benefit of protection is much more greater than the risk of a side effect that can come from the vaccine. The second question that's equally as important is, are the vaccines effective? Now, that is something I'm going to answer a lot more in the next slide, so we'll skip over that for a little bit. Third is, why are they important? Why are vaccines important? Why are we vaccinating people against these illnesses? The reason why vaccines are important is because we are preventing life-threatening diseases and illnesses. The vaccines are protecting our bodies from being infected with life-threatening diseases that, if we were to get, we don't have good treatment for. So thinking about the old saying that many people will say, it's always better to prevent than cure. With these diseases, we know that prior to vaccines, they were killing a lot of people. We know that they are very dangerous. And even if you were to get them and survive, some of them, including something like polio, have the ability to leave people debilitated for life. So the importance of these vaccines is to prevent life-threatening or life-altering illnesses, and that's why they're so important. The last thing I discuss commonly, especially in my pediatrics clinic, is common concerns and myths that people will encounter. Now, these concerns are important because most people want to do what's best for themselves and what's best for their children. And it's important as health professionals that we're answering the questions that parents or people have to the best of our abilities. Now, many concerns come up, including feeling like there are just too many vaccines that we give children. Now, it's true if you compare how many vaccines we give kids now to how many vaccines we gave kids 50 years ago. There are more vaccines, but those vaccines are here because scientifically, we've learned a lot more about how to prevent illness, how to make vaccines most effective, and how many doses you need to be fully protected against the illness. Some parents are worried about how many vaccines each child is getting and how many we give, including booster doses. Now, when you are getting a vaccine, some parents worry about the antigen, so the material that we inject people or kids with, and if that's going to be too much for their immune system. Now, I understand why parents are concerned about something like this. Kids are our most prized possession. They're the thing that we worry about the most. But I do want to reassure seeing a lot of things on a daily basis. We see kids encounter germs every day. And the number of germs that a kid would encounter on a playground is actually more than any antigen that a child would get from a vaccine. I mean, sometimes that helps some parents think about risk versus benefit as they're weighing, should I give my child these vaccines or not? Now, a last myth or concern that has come up in many communities, including my own community, the Somali community, is the link between MMR and autism. Now, I don't even like repeating misinformation because we have seen and proven time and time again that there is absolutely no link between the MMR vaccine and autism. Autism is a neurological process, and there are many kids who have been diagnosed with autism, but this is not in any way related to the MMR vaccine. There have been many studies, including studies of children, over 650,000 children, where scientists have studied to see if there is any link at all. And time again, there has been proven to be no link between MMR and autism. Next, we'll go to the next slide now. So this slide will help us answer a little bit about, is the vaccine effective? Okay? Or are the vaccines that we are giving people effective? As you can see, on the left-hand side is the name of the disease. In the middle column is the population. The third row looks at how many cases we have recently. And I am not sure. Okay. Can you hear me now?
Yeah, there was a brief pause. I think
Oh.
you're back on, Anisa. Thank you.
Okay, sorry about that. So I will start off so that I'm not sure where I was, but do you remember? So the third row look.
Yeah, I apologize, Dr. Ibrahim. I think you have frozen. Just a moment, everyone. We thank you for your patience.
Sorry, I think I lost connection with you guys. Am I back on?
Yes.
Okay,
thank you.
so sorry about that. I have no, maybe it's the weather or the winds.
Yeah, I don't think that we've heard very much from this particular slide.
Okay, let me, as I'm sharing my slide. Okay, so this slide is going to be talking about how effective vaccines are. So on the left-hand side are the diseases that we we have vaccines for, or the diseases that we vaccinate against. The second row looks at how many people per year used to die of each illness before vaccines. The third row is the number of cases that we've seen reported or deaths reported in the United States. And the last row is the percent decrease. Now, as we can see, the first thing that we can discuss is diphtheria, which was a disease that prior to vaccines used to kill over 21,000 people. And after vaccines were implemented and everyone was being vaccinated, there was a 100% decrease. So much so that most people have not even heard of this disease recently. Second, as you see highlighted here, is polio. So before the vaccines, over 16,000 people died from polio. This does not account for the number of people who got polio, recovered, but still were affected, meaning had a leg or an arm that did not work as well as it used to prior to getting the disease. Since vaccines, there has been a 100% decrease in polio, meaning you don't see polio anymore. Another disease that has been eradicated by vaccines is smallpox. And then one that I think we have seen come up time and time again, the measles vaccine. Before the MMR vaccine, measles used to kill over 500,000 people per year. And most recently, in the US reports, it was about 69, which is a 99% decrease. Now, overall, we know that vaccines are very, very effective. However, because vaccines have been so effective, many people have not even seen these diseases that I just discussed. They haven't seen anyone affected by them, and that's because the vaccines have been very, very effective. Sometimes, because we don't see these illnesses anymore, we are not able to think about the risk that they might pose to our health. And because these illnesses are still around, if we stop vaccinating at any point, or if someone does not have protection, you are at risk for getting that disease or that illness. So it's very important to continue getting the vaccine so we can continue to remain protected. Now, this slide is our reminder that we just talked about routine childhood immunizations. And because our focus had been on COVID and so many orders to stay at home and not socialize and social distancing were in place last year, we really have to remind ourselves that influenza or the flu is also a very deadly disease. Many people can get very sick from it, and many people have died because of the flu. Now, the COVID-19 pandemic means it's very important, even more important than other years, to get your to get your influenza vaccines. There's a lot of people who are starting to come back into in-person activities. Our kids are back into school, which means that COVID and the flu can spread. And both of these are respiratory illnesses that can make people very, very sick. It is safe, and the CDC and all the regulatory bodies agree that it's safe to get your flu and your COVID-19 vaccines at the same time. And it's very important to do so right now before more flu is seen in our area. Now, in King County, I'm so proud to be a part of a county that really makes sure that everyone can access vaccines, especially vaccines that are very, very important in the prevention of respiratory diseases. So if you are in King County, you can be eligible for a free vaccine. If you're 19 and above and have insurance, your flu shot will most likely be covered. If you're under 19, so a child or pediatrics, you can get a free flu shot from any provider in the Vaccines for Children's program. And many of the clinics that your children go to are a part of this program. And if you don't have insurance or a healthcare provider, we have resources for you. So please make sure you're able to get into contact with someone. Now, I want to switch gears a little bit and talk about COVID-19 vaccine and why it is so important. I think in the beginning of the pandemic, and even now, some people think that kids are immune to becoming sick from the COVID-19 infection. And that is simply not true. Although kids have cases that might not be as severe, some kids can get very severe illnesses. Kids have died from COVID-19 infection, and other kids have gotten a life-threatening disease or illness called multi-system inflammatory syndrome. Now, that is a very scary and sometimes deadly complication of COVID-19. Children, even if they do not get very sick, can spread the infection to other people. And because kids don't live alone, they put other people at risk. That means they can put their parents at risk, they can put their grandparents at risk, or even their younger siblings who are in a higher risk category, such as infants. Children can also have long-term side effects or long-term effects from the COVID-19 infection. And that is something that we don't know a whole lot about. We know the long-term side effects of the COVID-19 vaccine and that it is safe and effective for kids. But the COVID-19 infection itself, we are still learning about. Currently, we know that some people, including kids, have long-lasting symptoms who we hope get better, but we do not know, and there's currently no specific cure for these. So it's very important to vaccinate and prevent the COVID-19 infection. or ensure that their body has protection before coming into contact with the COVID-19 infection. Now, just like all other vaccines, I'm so happy to say that the COVID-19 vaccine is safe and effective for young children. Currently, the FDA did all of its regulatory work and showed that there is no serious safety concerns, both in clinical studies and once the vaccine had been rolled out. And it is a safe vaccine to give children. Currently, any child 5 and older can get a COVID-19 vaccine. We know that it's effective, and we know that the risks of getting the COVID-19 infection far outweigh the risk of getting the COVID-19 vaccine. So because of that, all pediatricians and all of the regulatory bodies are encouraging families, especially families with kids, to get their children vaccinated against COVID-19 because it's one of the best ways to protect your child against this infection. Now, COVID-19 boosters. So COVID-19 boosters, or the third vaccine, or sometimes the second if you got the Johnson & Johnson. The boosters are important so that our body can continue being protected against COVID-19. Now, boosters are not something new, and it's not something that is only for COVID-19. When you were younger and got a vaccine like the polio vaccine, people would get 2, 3, 4 doses, which now, the terminology can be, we were getting boosters after the first dose. And the reason for that is, after a while, our body's immune system or our body's protection might decrease. And when we get a booster, it picks up that immune response again, so we can have maximum protection. Now, the FDA and the CDC specifically, has recommended that everyone age 16 and above who got their COVID vaccines, either 6 months or greater, can get a booster. If you have gotten, so for kids are only getting the Pfizer vaccine. So for all kids 16 and above who got a Pfizer vaccine more than 6 months ago, they are eligible to get a COVID-19 booster. And the current recommendation is that your booster dose can be the same or different from the first vaccine that you got, which means if you first got Pfizer, you can now get the Moderna as a booster, or vice versa. It's a good idea to get a booster because right now we are seeing that there are variants that are much more infectious than previous variants. Right now, the most common circulating variants are the Delta variant and the Omicron variant. This is a time where we should get our boosters so our bodies can have the most protection against all of the variants, and that if we were to get into contact with this virus, that we will not get, it will help us protect against severe symptoms, hospitalization, and death. Now, the risks of the booster are very minimal. Just as before, some people do have some side effects, including feeling tired, having a headache, having some body aches. Those symptoms typically, again, last about 24 hours and then they go away. There are no long-term side effects that have been, again, seen or reported with the COVID-19 booster, so there's not a lot of additional risk. Now, this news actually came out, I want to say, about 1 week ago. There is a regulatory body, so ACIP, they updated their COVID-19 recommendations, saying that they prefer people to get mRNA-based vaccines, meaning they prefer or recommend higher that everyone gets a Pfizer or a Moderna vaccine instead of the Johnson & Johnson. They made this recommendation after reviewing a lot of safety and side effect data. And their preference currently is that people get the Pfizer or Moderna vaccine and over the Johnson & Johnson vaccine. However, if someone is most comfortable with Johnson & Johnson, they would like people to have a vaccine rather than have no vaccine. Last week, the CDC endorsed, meaning that they agreed with this recommendation. And now the CDC is also recommending that everyone get a mRNA-based vaccine rather than a Johnson & Johnson vaccine. I think that was my last slide, and I'm happy to hop off and take any questions. And there are 2 websites listed here, which we will share, where people can get information about finding a clinic, and then also where they can get COVID-19 vaccines. All right, I will stop sharing my screen now.
Great. Thank you so much. We appreciate you sharing. Very insightful. So this will open up a time for our question and answering. Are you guys hearing me okay? Yes?
Yes.
Okay. And so there's a couple things in the chat that one says from Victoria, she wants to share her insight into benefits of, share your insights, any insights on the benefits of mixing for or staying the same. If you have a choice between picking Moderna and Pfizer, is there any insight into one being more effective than the other?
Yeah, so that is a great question. So there were some studies, right, that showed that if you mixed, you might get slightly more protection than if you continued along the same, it continued and just got a 3rd dose of the same vaccine. I think right now the recommendation is that you get either one. So if I were to walk into a pharmacy and I had gotten Moderna and they told me, I have Pfizer, would you like this booster? I would definitely get it. And if I walked in and they said, I have Moderna, would you like this booster? I would definitely get it. So there are some studies that did show that you can have higher protection or higher immunity if you mixed the vaccines. There has not been a strong recommendation from scientists one way or another. It's the recommendation right now is to get that 3rd booster of either one so that you can have maximum protection.
She also stated that Moderna isn't recommended for use in people under 30 in Europe due to heart complications. Do you have any insight on that as well?
You know, I am not sure how I don't know how the European regulatory bodies came to that conclusion. I know that essentially each country kind of looks at they look at their own safety data. So when I did look at and review the Moderna safety data, I did not find that there was an increased number of heart complications compared to the baseline general public. So I agree with the current U.S. recommendation that we continue to use Moderna in the 18 and above. The important thing to know is that for Moderna has not been approved in pediatric populations. That's only the Pfizer vaccine. So it's really in that 18 to 30 age group that we are differing from the European recommendations. And with the number of people that we have vaccinated in the United States, I think we are at over 2. Goodness, I can't even remember the exact number. We've vaccinated a significant number. None of our safety regulations have kind of pointed towards saying that there is a higher rate of heart complications in people who've gotten the Moderna vaccine. But I don't know the European studies, so I apologize for that.
And just before we open it up for other questions, Deborah, do you want to elaborate on the Community Health Access Program?
Sure. Earlier, Dr. Ibrahim had mentioned that if you need health insurance or provider, King County can help. And I just wanted to put that information out there for anyone who wants to take advantage. At Public Health Seattle King County, we have a program called the Community Health Access Program, shorthand called CHAP. And that can help people get health insurance, find a healthcare provider. It can also help with things like energy assistance, prenatal health, health screenings, getting food vouchers, and more. So just if you want to take advantage of that, you can call 1-800-756-5437 or email CHAP, CHAP, at kingcounty.gov. And all of that information is in the chat as well. Thanks, Cynthia.
Thank you, Deborah, for sharing. Excuse me. Are there any other questions or comments? I know we have a few people that have just arrived. Thank you for joining us. We're at our question and answer time. And if you put your email in the chat, we can certainly email you the slides. Let's see. Okay, Jamie, I'll turn it over to you to share with us.
I think I first want to make sure that everyone who joined us a little late are aware that we have this is available in both English and Somali. So if you can please scroll down to the globe at the bottom of your screen and you can select English or Somali so that you are able to hear the presentation in the language of your choice. I also wanted to make sure everyone is aware that we are recording tonight's session so that we are able to share this with as many people as possible in our community. We know it's a weeknight. We know that some of you may have your children off from school due to the holidays. So we want to make sure that this is something that people can watch at their at a time that is convenient for them. If you're not comfortable asking a question, you're more than welcome to put your question in the chat. We are covering topics about COVID-19 vaccines, pediatric vaccines, routine childhood vaccines, and a flu vaccine with Dr. Anisa Ibrahim, who is just a wonderful, knowledgeable expert on this information. So please feel free to post any questions you have for her in the chat. I know that I formerly worked at a COVID-19 vaccine clinic and have worked with King County doing COVID response for quite a while. And there are some common questions that I have come across that might be some of the questions that other people in the audience might have. And so, you know, one of the questions that I think, at least as a common concern as of late, is how well does the booster protect against the new variant or just the vaccines that we've been receiving? I know that there's a lot of questions and concerns about that.
Yeah, absolutely. So that's a great question. And I think that we are still needing a little bit more information. I know that recently, when they were looking at and seeing how well is it doing against the Delta variant, both vaccines seem to be doing pretty well at protecting us against the Delta variant of the vaccine, the Delta variant of the infection. Now, the newest variant is the Omicron variant, and there's a lot that we don't know about the Omicron variant yet. We know that it's very infectious, meaning that it can spread to many more people and is more infectious than the Delta variant. However, we don't know if more infectious means more severe. We don't know if more infectious means more hospitalizations. We don't know if that also means more death. Now, while we can hope for the best, it is spreading very fast. And I think that because it's so much more infectious, we're going to see a lot of people who are sick. and a lot of people who are getting hospitalized due to the new Omicron variant. Both Pfizer and Moderna have started to comment, and we think that the vaccine and the booster do provide protection against the Omicron to some point. I just don't know, and I can't quote a percentage right now, but we do know that the vaccines give you protection, and that it is definitely highly recommended to get a booster right now.
Thank you. Another question that I have heard a lot about is questions about fertility and safety for women who are, and this isn't just for COVID vaccines, but for many different types of vaccines. But I'm wondering if you can comment on recommendations for vaccines for pregnant, breastfeeding women, women who are considering getting pregnant. Not just for COVID, but for other types of vaccines that might be relevant.
Right. So because I'm a pediatrician, I don't want to comment too much on the vaccines for women who are newly pregnant. However, I know that there are some delays in getting live virus vaccines in women who are pregnant. However, that being said, specifically to the COVID vaccine, there have been no links to infertility or effects of fertility for the COVID-19 vaccine. Many people were concerned that it could affect fertility, but there is no evidence to say that the COVID-19 vaccine affects fertility. Now we have millions of people who've gotten the COVID-19 vaccine, and there have been many women who have gotten pregnant after getting the COVID-19 vaccine, who have delivered healthy babies after they got their vaccine while pregnant. And there's many women, including myself, who got vaccinated while they were breastfeeding an infant. And for the breastfeeding women, we have seen that if you are continuing to breastfeed your child, you are giving your infant who cannot get their own vaccine protection against COVID-19. And that is something that is amazing because those kids cannot get a vaccine right now. So when you look at the evidence, there's been no evidence to show that the COVID-19 vaccine affects fertility. The American College of Gynecologists and Obstetricians, they have, who's a group of doctors who care for women who are pregnant, have all recommended that women who are pregnant or childbearing age get the COVID-19 vaccine, because we have seen that women who get the COVID-19 infection while pregnant are very high risk, and they're at high risk of having complications from COVID-19 infection. Now, we recommend all other vaccines for women who are pregnant because we know that they also do not affect fertility. Now, when to get those vaccines if you are pregnant is something that I would recommend talking to your doctor about.
Thank you so much. I think there's a question just about to add on to what you were commenting and discussing about the booster just a little bit ago. Is there a 14-day wait period with the booster to be fully effective, as there was with the primary series?
Right. So because, when we look at when you're considered fully vaccinated, we're looking at the primary series and how, what is the wait time from the time that you get your second dose until we consider you fully protected. Now, because the booster works in a little bit of a different way, because we expected that you were fully protected and then that your immunity came down a little bit and then you get this booster. Now, again, the booster is going to take a little while to work, but there are no clear, cut guidelines for when we say, yes, you're fully protected, or this is a 14-day wait period, because your body is starting off with a certain level of protection and you are just increasing that. So because the body and the immune system does take a while, I would not say that you're instantaneously more protected once you get the vaccine, but there is not this 14-day kind of wait period. I would consider it as once you get the vaccine, from that time moving forward, your body is increasing its protection, but it's not starting from zero because you are already considered fully vaccinated.
Thank you. I know there's also a lot of concerns about, especially with the COVID-19 vaccine, safety just related to FDA approval, this emergency use authorization.
Mhm.
And many people felt more comfortable with Pfizer once it received FDA approval. I'm wondering if you can first explain if where Moderna is in that, if you know, if Moderna is in line to get FDA approval yet, and then maybe discuss a little bit about the difference between the emergency authorization versus the FDA approval.
Right. So that can get very, very complex. So the Moderna, I believe it is in process to get that full FDA approval. However, I do want to say that these vaccines would not have been released to the public if they did not meet all safety and regulatory guidelines, meaning that we knew that they were safe and that they were effective. And now there is a certain timeline that many vaccines have to go through to get full FDA approval. And this can generally, after the first clinical trials that show that the vaccine is safe and effective, it can sometimes take years for the FDA to continue monitoring and then say, yes, this is a safe and effective vaccine because we've seen it given to this many people, and here are the safety and regulatory measures. Now that's a timing thing. That timeline typically works well if we're not fighting a global pandemic that's killing hundreds of thousands of people. So when the FDA, when they said we can use an emergency use authorization, they authorized the vaccine because they saw that it was safe and effective and that there were not negative side effects that we were seeing or large negative long-term side effects. So they approved it on an emergency use basis. And then they continue to track that data and then reviewed it again. Pfizer submitted it for full FDA approval, and Pfizer was able to get that full FDA approval. The Moderna vaccine, again, is safe and effective, but it is in the process of getting that full FDA approval. In the context of the COVID-19 pandemic and infection, we know that the vaccines are the one and strongest tool that we have to protect ourselves against this illness. I would caution against saying, oh, it doesn't have the full authorization yet, because it has been approved for emergency use. I'm happy to send people some more information as I get it, but I don't have it in front of me right now.
No, that was really, really helpful. I think maybe we have just one last question. And oh, Deborah, you read my mind. So, she said, since COVID is relatively mild for children, why is it so important for kids to get vaccinated? You mentioned long COVID. Can you say a little bit more about that? What do you
Yeah.
tell parents who are concerned about their child having a vaccine that's relatively new?
Right. So what I would tell parents about the concern of the vaccine being new is that this is one of the first times, it's definitely the first time in our lifetime that we've had a pandemic in which all of the world scientists were actively working to find a vaccine to help protect us against COVID-19. The governments were also fully supporting the scientists with money so that they can do this research fast for the COVID-19 infection. That being said, the technology, so the mRNA portion that is used to create the Pfizer and Moderna vaccines, is not new. This technology has been studied for decades. We know what it is. We have been studying it, and that technology is not new at all. So the technology used to create the COVID-19 vaccine is something that we know and has been studied for decades. The COVID-19 vaccine itself, of course, is new, but all of the steps to ensure that this vaccine is safe were taken, and there were no steps that were rushed in order to get this vaccine out to the public. Now, the question about COVID being relatively mild for kids is one that's very important. We know in general that COVID might be more mild in kids, but we also know that COVID can kill children. And that is a gamble that I'm never comfortable taking with kids. And the reason for that is because we don't know which kid will be the one who gets COVID and do fine versus the child who gets a COVID infection and ends up in the ICU versus the child who gets COVID and dies from it. Now, no child should die from a vaccine preventable illness. So even though most cases are mild, there are enough cases that we know are making kids very sick and that kids are dying from this infection. The other thing that we know is that kids are getting what we call long COVID. So the child gets sick with COVID. They recover from that initial illness, but they have symptoms that are debilitating, that continue for months and years. And we would not be in that situation if that child had gotten a vaccine to prevent it. Now, long COVID is scary because doctors don't have many answers. And we've seen kids who many months after getting a COVID infection still are not able to breathe as they typically would. Kids who are much more tired and can't think like they typically would, and kids who have GI issues with no end in sight. Those kids are considered recovered from COVID, but they have long-term life-altering complications. And that is why we are always saying it's better to prevent this infection from getting to your kid than taking a gamble on how well will my kid do if they become infected without any protection. And that's why all pediatricians really do stand behind saying, we think that getting the COVID-19 vaccine is the best way to protect our children.
That was a fantastic response. Thank you so much. I think given the time, and we want to be respectful of your time, I think that was probably the last question, unless anybody had anything quick they wanted to put in there. Otherwise, I just wanted to remind everyone who joined us late that we are recording today's session, and we will, post this recording for people to view at another time, so that it's something that you can see if you were unable to catch the whole thing. And you can also share it with your friends and family and the people that you think would really benefit from hearing from Dr. Ibrahim's expertise. Cynthia, would you like to wrap all of this up for us?
Sure. So I'd like to thank you, Dr. Anisa Ibrahim, for your insight, for answering taking our questions and taking time out of your busy schedule to touch on these topics. I'd like to thank everyone for showing up. And if you have any further questions or need more information, we've put items in the chat, but you could also feel free to email me, and I'm going to put my email into the chat if you want further information you need any. Thank you, Jamie, for putting your email in there. And just feel free to contact us. There's lots of events going on in the community. We usually post those on our website, and we also have a weekly email. So if you would like to be on that email list, also add your email to the chat. And I'll just let Dr. Ibrahim say her goodbyes. And I do want to say to Public Health, thank you for working with us. Thank you for helping me put this together. Any final words, Dr. Ibrahim?
No, thank you so much for having me. I hope that the session helped address some of the questions that people had, and really want to say I hope that everyone stays safe out there, especially right now as we're seeing the newest increase in COVID-19 infections due to the Omicron variant. I hope you guys have a great rest of your week.
Thank you. If nothing else, this concludes our meeting at this time. Have a good evening. Happy holidays.
Thank you, Dr. Ibrahim.
We'll